Welcome folks to the last video. This is the reproductive part 2. So we'll trying to get all of these done. So second part of the reproductive system. Uh, okay. So let's talk about gametogenesis. Gametogenesis is where things actually happen. Okay, where things happen. How the sperm come about and also how the eggs come about. So we're gonna spend a little time talking about these. Okay, but before we get to any of those, let's kind of review really quick. Hopefully, this is something that you should know already, I believe, from your bio class, by either bio 100 or um, bio 1, I believe 161, 181 as well. Okay, so a couple of ideas. First one is mitosis. Okay, so I just wanted to spend a little time talking the differences between mitosis and meiosis. Okay, what are the difference between these two concepts? Okay, so mitosis is when you copy a cell, when a cell, let's say I have a cell here, one little happy cell here. If you have this one happy cell, will somehow copy itself, and at the end of that process, it actually turn into two, okay, two very identical cell, okay, so two identical cells. That's called mitosis. Okay, so you have mitosis, you have one cell, one original cells, copy, split it, copy itself and make into two cells. Okay, so this is called mitosis. And if you remember from your cell cycle, um, where um, you have a couple of cycles for nurses, you still need to know these. Um, so for nurses, you still have to know these, the cell cycle, in order for you to split from that one to two. This is how your cells actually live. You have this part here, which part of what we call mitosis, M for mitosis, and then you have right here is called G1, which mean growing. This is you just growing, you just spend time growing. And then you have the right here, boop, this is called SO, which means that you duplicate your DNA, DNA duplication. So you double the amount of your DNA. And then you have this one, which is called G2, which is you grow some more. So you grow one, duplicate your DNA, which is S phase, and then you have G2. Okay, and in your mitosis, you break it down to P, M, A, T, C. PMATC. So PMATC is in your mitosis. So these are the stages of how your cell duplicate, going from 1 to 2. Okay, going from 1 to 2. Okay, you have prophase, metaphase, anaphase, telophase, and cytokinesis. Prophase is before, so things just condensing. So prophase is just your nucleus, your DNA start condensing. You start seeing your chromosome lining up. Okay, metaphase, so okay, meta or met, I always remember as met. So met is you line up, you meet in the middle. So meet in the middle. So met, you meet that in the middle. Anna is going away. So A for Anna, A is for away, when your chromosome starts splitting away from one another. So that's Anna. Telophase telo is they so far apart they have to telephone each other. They actually on a way opposite end of your cell. The cells start to divide. You start seeing the cleavage of the cells. Okay, you start seeing these cleavage. Yes, just like the breast, you have these little cleavage, the cell about to split, and then cytokinesis. That's mean you forming a new cell. So you splitting cell into two. Okay, so you have these nucleus, a chromosome on each one. So these you still need to remember. It won't be on on this test. On this test, you will need to know the differences between mitosis and meiosis. But in terms of the cell cycle and all of these, you still need to know for your nursing class. Even your for those you are going to dental hygienist, you still need to know these as well. One additional thing that I didn't mention really quickly, and I'll put it in a different color. In some cells, you don't have just G1. Some cell, this is majority of your cells will go on this cycle. They separate it, they grow, they duplicate your DNA, they grow some more, they separate it again, they replicate themselves again. Some cell will do less duplication, like your nerve cells sometimes doesn't go through the duplication. So instead of G1 going to S1, they're going from G0, and they don't duplicate themselves. They just kind of stay there as G0. They grow and then they die. Eventually they die. So they don't go through all of these. Okay, so that's the one exception. But now we know that not all nerve cells, nervous system cell go through the G sub 0, because some of them actually do replicate, but majority of them don't, or maybe they do it on a much slower pace. This science still kind of go back and forth. So 10 years ago we say nope, they're not replicating, then we say yes, and then we say no again, and now we say yes again. So we're going back and forth. But just know majority of your cells, so your cell from head to toe, even when the sperm meets the egg, go through this process. When sperm meets the egg, make into a cell, then they go to mitosis to actually become, replicate themselves into a whole bunch of other cells. Okay, so that's the process of this here. So okay, so meiosis is completely different. So you have one cell. Okay, meiosis, you have one cell. You go through it a couple of times. First time you divide it into two. Okay, so you divide it into two. We'll come back and now make a change of this, and then the second time you get into only half of that too. So you only have half of what you start off with, so you actually end up with 4. So okay, so meiosis, you instead of 2 as a result, you start with 1, you go into 2. This is called meiosis 1. This is meiosis 2. 1 where you're going from 1 cell to 2 cell, but then the meiosis 2, you're going from this 2 cells, you're going into the half cell. Okay, you only go into the half cell. You don't go into actual 2. Okay, so but there's a caveat to this. This is not, so this mitosis is you actually have 2 completely duplicate cells. You have 2 identical cells. In meiosis, you do not actually have 2 identical cells. So what happened in meiosis is when the chromosome lines up. Let's say you have this chromosome, the green chromosome. Let's see. Hold on. Let's see. We'll draw another one. Okay. So you have this green chromosome line up with the red chromosome. Line up with the red chromosome like this. Okay, and they start to intertwine. Okay, they start to intertwine, and what happened is they start exchanging parts. They start exchanging parts from one another. Okay, so exchanging parts from one another. So like that. Uh, so to make sure that you have a genetic viability, which mean that you actually have more choices when you start to split apart. Okay, so you actually exchange arm or certain pieces. So this is to guarantee that, let's say, if you suck at running, if you cannot run really well, you get eaten by dinosaur. You're not gonna pass that gene on to your kids. Your kid's not gonna be suck at running as well, and then get eaten by dinosaurs. So you create this diversity in your cell, so you don't have to pass that on. So some kids, like let's say this first chromosome, will get this side part of the chromosome here, okay, this part here, and the second guy will get just the second part here, and then you have this one. Okay, so in this way, okay, so in this way, you have the red here, you have the red here, and then you have the red here. So, and these four sperm actually will have four different chromosomes. For each one actually will be completely different from one another because of this genetic variation that we created. That's why sometimes you have these beautiful, gorgeous parents, and then their kids come out completely ugly, or vice versa. Have these ugly parents, and then the kid is like, "Wow, has that girl been adopted or something?" So this is what meiosis does: is to create that diversity between when you actually have this. So meiosis only happen in your reproductive system. So keep that in mind, that your meiosis, it only reoccur in your reproductive system, in your sperm and your ovaries or your egg, your sperm or your egg. This is where all of these happen here. Okay, so these are the four sperms here, and then these are four eggs. So you only have, the reason I draw half, because you start with 46 chromosome, but at the end, each one of these have only 23 chromosome each, which is kind of makes sense if you're gonna use that chromosome to meet, to like the sperm to meet with the egg, so to make 46, so you need half and half. So so meiosis only referring to reproductive system, whereas mitosis is everything, from your head to your toe, from first day when the little sperm and egg meet until even now, as you sit and watch this, your mitosis is going on everywhere in your body, where where your cells split into two, reproduce itself all the time. So anywhere in your body that's not the sperm or the eggs, that you will have mitosis, and meiosis only where you have the sperm and the egg. Okay, so let's dive into this a little bit more. This is just the superficial stuff that I want to cover. Just kind of review stuff to make sure you know these things. Okay, so mitosis produce two genetically identical diploid. That's what I was talking about. You have two completely identical two cells. Whereas meiosis, you only produce haploid, which means that you have only 23 chromosome instead of 46. Diploid, which is two set of chromosome. Haploid is only one set from the mom or the dad. Okay, so as you can see here, you have genetic variation. So mitosis, you completely copy, duplicate your cell exactly. You start with like this, you duplicate, and you have exact copy of it. Whereas meiosis, you have variation in your cells at the end. Those variations. Okay. So meiosis have two two rounds. Like I mentioned before, you have round one and round two. Round one, you're going from, you end up with 2 haploid, and then round two, you end up with 4 haploid. Okay, so round one, you have 2. Even the 2 is not identical. And then round two, you have 1 haploid, which is only half. That completely different. Each one is completely different. Okay, so we talk about the variation, genetic diversity. So this is a good thing that we have. We have random assortment, random switch. You could see how these arms get crossed and then they switch the leg, and this is kind of um, a general picture. It may only switch certain section. Let's say it may only switch this section here, so this section might goes to here, and this section might goes to there. So it actually could have different variation, different section that actually switch. So yeah, so this is a good thing technically. Unfortunately, my son just pick up all of the bad stuff from me and my wife. I haven't told him that yet. I'll wait for him to get a little older, and I'll break the news that you just get all the bad stuff from your mommy and your daddy. So, but that's genetic dice right there. So, okay. Okay, so let's talk about sperm production. We're gonna go into the sperm production. This sperm production in testes, the other term for this is called spermatogenesis. Same thing. Okay, sperm production. Spermatogenesis. So this is what I want to focus on today, spermatogenesis. Again, to remember this, you need to know this Satori cell. Satori cell, this is where you promote the sperm development. Okay, promote sperm development. Interstitial cells, this is where you produce the sperm, where you produce the, not sperm, I'm sorry, produce the testosterone. Testosterone, very important in terms of making you male, because without testosterone, you will become female. Okay. Spermatogenesis. Let me kind of go over these. This is very important. This is important to know. You're going to see this in your exam. You're also going to see the mitosis as well. There are several questions about mitosis and meiosis. All the stuff that I just mentioned, you should definitely know those. That's why I spent a little time on mitosis and meiosis. Okay. So spermatogenesis, this is where you produce sperm. The first process is mitosis. So let's say you have this cell here. This is called spermatogonia. This is the first process. You have this cell here, the 2N, which means you have 46 chromosome. You go through mitosis. You go through that mitosis, and you split into 2 cells. You split into this guy and this guy. Okay, and you have the A versus the B. A versus B. A doesn't get to go anywhere. A goes back and repeat this whole process again. A just repeated the whole process again. So just go back and then reproduce again. Split into 2 again and keep doing that. So A doesn't get to see the light of day. A just kind of gets stuck here and does only one thing. Just keep copying itself. Just keep copying itself over and over again. This is great because this is a way how you produce so much sperm. Okay, that's how you produce millions and millions of sperm. 20, 50, 100 millions of sperm. So this is, you just keep repeating itself all day long. Okay, B, on the other hand, B is what we call a primary spermatocyte. Primary spermatocyte. So type B and primary spermatocyte, exactly the same guy. So this guy comes down, get to go outside, come down to play down here. Okay, so A doesn't go anywhere. keep splitting themselves over and over again. B gets to come down and then goes to the meiosis one. Meiosis one. So the primary spermatocyte gets to go through meiosis one. Then you start to have that variation. Remember when you talk about meiosis 1, this is where you already have that genetic diversity. You're going from 2N to only 1N. You only go to 1N. So you actually go through from 46 to 23. You're going from 26 to 23, that in that meiosis 1. Okay, and then you go through meiosis 2. So this is called the secondary spermatocyte. Secondary spermatocyte. So primary is before meiosis 1. The result of meiosis 1 gets secondary spermatocyte. And then secondary then go through meiosis 2. Then you get into spermatids. Spermatids. So I always remember tits, not titties, tits, but tit like kids. Okay, so this is the little baby sperm. So spermatids is baby sperm. So kids, like little tiny kid of sperm. Okay, and then you go through what we call spermiogenesis. Spermiogenesis. Okay, so this is spermatogenesis. Okay, genesis means create. Sperm to create sperms. Okay, spermiogenesis. Okay, this is just development of sperm. Okay, development of sperm. Think of mio, kind of like the word mature. So think of it like maturing of the sperm. Okay, maturing that sperm. You're going from this spermatid, like little kid, to spermatosaur. Spermatosaur. Okay, so remember that you have only two. Okay, when you split this, you split into two secondary spermatocytes. When you go through meiosis 1, you have two secondary spermatocyte, and then once you go to meiosis 2, you get into spermatids right here. Okay, right at this stage, this is spermatids. Okay, and spermiogenesis, you're going from spermatids to spermatosaur. Okay, so you become little more mature. Okay, so same picture that I just described that to you. Okay, and all of this, where does this happen? Where does this happen? This is happen in the seminiferous tubules. So this is where you create sperm. You create sperm in the seminiferous tubules. Okay, this is where the sperm is created. Okay, spermatosaur, we covered this already. I talked about this. You have the head of the sperm. You have the acrosome, which is the enzyme. At least it will contain the enzyme that penetrates the egg. Okay, you have the mitochondria, that's the powerhouse creating energy, and then you have the flagellum that makes it move. Okay, now we talk about the egg per se. So we already talked about the guy, now the sperm. Now we're gonna talk about the egg. So the egg is oogenesis. Oogenesis. So you pronounce, and that's what my anatomy teacher taught me. Oogenesis. Okay, oocyte, oogenesis. So this is we're gonna talk about. It's a little different than the men. Okay, you have little different process. We'll come back to this page, but let's look at this here. So oogonia, which is the original sperm, you have original cells. Okay, again, oogonia, kind of similar to spermatogonia, where you actually have the A and B, right? You have one cell, split 2N, split into 2N as well. Okay, 2N, and one of them just repeat itself. The A repeat itself. Okay, same thing with this. The A right here, this guy, split into two. The A repeat itself and do this whole process again. Whereas the B become the daughter cells. Okay, go through the meiosis 1, okay, go through meiosis 1, um, which is here, meiosis 1, okay, first meiotic division complete, you get 2 cells, right? The meiosis 1 from the primary oocyte, you have the primary oocyte, then become the secondary oocyte, and that you have only haploid here, and then you have the meiosis 2, which is here, okay, that develop into the egg, okay, develop into the egg, okay. So when women when girls actually born, you actually go through this right here. You stop right here in the meiosis 1. You kind of went halfway through meiosis 1. So you have these you may divide into form of polar body. Some women may not go all the way completed to this process, but you stop right at the meiosis 1. Okay, this is before you are born, before you actually come out. You actually, your ovaries actually stop around meiosis 1. When you hit puberty, and each month you continue the meiosis 1 and go into meiosis 2, and then you have all of these develop later on. Okay, so you go into the secondary oocyte, and then you release that secondary oocyte into the fimbriae, into the fallopian tube. The fertilization, this is another thing that you should know. Fertilization occurs in the fallopian tube. Fertilization occurs in the fallopian tube. Okay, this is where your sperm meets the egg, when Harry meets Sally in the fallopian tube. Okay, so this is a process you definitely need to know. It's actually on your exam. The differences between oogenesis versus spermatogenesis, and how each portion develops. Okay. The hormone regulations. Actually, before we move on, I think, do we have the actual? No. Okay, I guess not. I'm just gonna show you, since we on this. Let's see. Okay, so we will talk more about this process later on, and shortly, about probably 5-10 minutes from now, so we'll look into that. Okay, I'm gonna go into a little detail of what structure that's actually around all of these, which is also important as well because it's on your exam. Okay, hormones. We cover hormones a little bit in the endocrine system. So for the male regulation, hormone regulations, you start with GnRH. R, again, if you see the letter R, that's from your hypothalamus, releasing GnRH. You enter the pituitary, release FSH and LH. FSH stands for follicle stimulating hormone. It actually stimulates the follicle, whereas LH is luteinizing hormone, also help stimulate your interstitial cell, produce testosterone for men. Follicle stimulating hormone actually produce, androgen binding protein that helps stimulate sperm production as well. Okay, so one, FSH has to do with, you want to underline this, FSH has to do with producing sperm, so making more sperm production, whereas LH has to do with producing testosterone. Okay, it also inhibits the addition secretion of GnRH, LH, so this kind of working as a negative feedback to stop your brain to producing more. Okay, if there's too much of them. Okay, so GnRH to pituitary release FSH, LH to testes, but also again to not just testes, but to adrenal gland as well, to produce a small amount of androgen that can convert to testosterone as well. It also have a negative feedback to pituitary and hypothalamus, so they could stop if you have too much of it. Female, similar. Okay, you have GnRH from the brain, anterior pituitary as well, going to anterior pituitary leads FSH and LH. But for female, FSH, where did it go? Okay, FSH has to do with ovarian follicles, stimulate ovarian follicular cells to develop ovum, so producing egg and producing estrogen. So egg and estrogen. Whereas LH stimulate ovarian follicle to burst. So this is LH has to do with ovulation more so, whereas follicle stimulating hormone is just stimulating to make an egg and to make an estrogen, whereas LH producing ovulation and also produce corpus luteum, and we're going to talk about what that is shortly. Okay, so follicle producing hormone FSH. This one has also negative feedback to anterior pituitary and hypothalamus as well. But also it have a positive feedback, increasing estrogen, if it promoting to have more estrogen, keep producing more and more estrogen through your mid-cycle, okay, until it actually stop and fall. So again, hypothalamus from the top release GnRH here, pituitary release FSH and LH to ovary produce estrogen and progesterone to the uterus. That also provide a positive and negative feedback, depending on what it is, to pituitary gland. So positive and negative. This one is just negative feedback. Okay. Little trivia: biggest vagina. Biggest vagina. Any thoughts? Okay. Biggest vagina, amazingly 19 inches. To put this in perspective, majority on average women vaginal canal is about 4 inches, 4.5 inches. So technically speaking, that's all you need in terms of length, in terms of how long for the penis needs to be. It's just 4.5. That's all you need. You don't need 9, you don't need 10, you don't need 12, 13, 15. All you need is 4.5. Okay, so that's, but this girl was at 19 inches. 19 inches, that's like a cave. Literally, it's just like a huge cave. You could do spunkling in there. Just dive in and you're just kind of lost in there. So 19 inches of vagina. So that's the biggest one. But she's pretty tall. Look at her. I mean, she's 7'8" at the age of 19 years old. That's fairly tall. Luckily, she married someone who's 7 feet tall as well. So this guy is a normal person. This is the normal height. This guy here, completely normal, average height. But these two are just giants. This is the term where, and these folks, this is where we get the term giants coming from. New York Giants, right? Okay, so to be fair, we talk about largest vagina, so largest penis. This guy, I believe, still hold the record, 13.5 inches. 13.5 inches. His name is Jonah Falcon. He's in New York. He actually came out, have his own documentary as well in 1990 with HBO. So famous because of his penis size. I think one of the movies kind of use his idea to copy him. So regarding his penis size. So, and there's also another claim recently that someone actually had, I believe, 16 or 18-inch penis. But this guy actually lived down in Mexico. But he wrapped his genitalia, his penis, in a gauze all the time, and he refused to ungauze it. So, but he's saying that the whole gauze is his penis. Lo and behold, one day they actually asked him to go in did not ask him to remove the gauze, but just have asked him to do CT and do an X-ray. And it turns out that um, it's, he doesn't have that long. I mean, it's just a gauze. Most of it is gauze. So they kind of quickly remove him from the record, any record that he was trying to set. So anyway, so let's continue to talk about the female sexual cycle. Most women, you have the 28-day cycle. Some women may have 21, some might have 32, so it depends. But on average should be 28 days. There are 2 cycle. People usually don't think there's 2 cycle. There's only you have the ovarian cycle, which has to do with ovulation, and the uterine cycle that has to do with your uterus. Okay, so 2 different things. This is when you have poop out that ovaries, poop out that egg. Okay, that's the ovarian cycle. You poop out the egg. Whereas the uterine cycle, this is where you build up your wall. You're building up that wall of your uterus. Okay, so that's the uterine cycle. So 2 different things. Let's talk about the ovarian cycle first. Ovarian cycle has two phases. Okay, you're gonna see in a graph shortly, but it's actually divided into 2 phases. Right in the middle is the ovulation. So you have the first phase is the follicular phase in the first one, follicular phase, F, okay? It up to the ovulation when you actually ovulate the egg, which is 14 days. And your second phase begin, which is the post-ovulatory phase, which is your second phase. Okay, so we're going to talk about both of these. Okay, so your first follicular phase, first phase. This is what start when you actually have your menstrual cycles. So your day 1 is when you actually have that period. Okay, so day 1 is when your period comes in, follicular phase. Okay, so the follicular phase divided into 2 phases. You have the menstrual phase. This is where your period. Some people might have 3 days, some might be 5, 7, 10, varies from one person to another. So, but usually you have this first phase, day 1 to day 5. This one is important to know. Okay, pre-ovulatory phase, this is day 6 to day 14. This is when you're ready to get to ovulate, when you actually, the egg about to come out. And on day 14, that's when you ovulate, that's when your egg actually comes out. If you notice here, you have, right before your ovulation, your FSH goes up, your LH goes up. So this, you have the surge, what we call the surge, FSH and LH surge. It hit the peak before ovulation, and then as it comes down, and you actually ovulate after it comes down. Okay, so that's the first part, the follicular phase. The follicle development. This is what I was talking about earlier. That there's actually a name to this, to these. So you have the primordial follicle. Okay, primordial follicle. Primary follicle. Follicle is what's around it. Okay, what's around these things. Okay, you have the primordial follicle. Second, after you develop after the granular cell changes, then it becomes primary follicle. And then your third stage, you develop into zona pellucida. That's the granulosa cell changes, and then you start develop this layer on the around the egg itself. That's called the zona pellucida. That's think of like a pollution zone in a sense. You have these little white sheets around your cell. Okay, white sheet around your cell. Okay, so this is kind of separate the egg and from what nourishing it around it. And the secondary follicle, this is kind of what we call the primary oocyte. So the other name for these two stages is primary oocyte. So primary oocyte divided into primordial follicle and primary follicle. Secondary oocyte has this secondary follicle which starts to develop these fluids around it. It also develops theca interna and theca externa. These are the shells on the outside. Okay, and then there are fluid inside, and this is the reason why women have cysts all the time, is because of these little things here. Okay, these things, these empty stuff in here. So secondary oocyte then become mature, which is called the mature follicle or Graafian follicle, and you have zona pellucida, you have the antrum, which has liquid in them, you have the theca interna and externa as well, and then you release, you have this release. This is the oocyte, which has zona pellucida and a little bit of the cells around it. Okay, that's called the corona radiata. Corona radiata. All these beautiful names. Corona radiata. That's coming out with the egg itself. And these empty shells become what we call the corpus luteum. Corpus luteum, empty shells, and eventually it decayed into corpus albicans. Corpus albicans. So corpus luteum then goes into corpus albicans. So if these corpus luteum doesn't go down to corpus albicans, this is where you could have cysts in your ovaries. So some people actually have that PCOS. Is because of these guys here, these corpus luteums. Okay, so you should know these names. You know these names as well. You're gonna see, we ask you these on your exam. Corpus luteum. What is corpus luteum? Just think of like a leftover of your egg that left inside your ovaries. Okay, and you have a corpus albicans. This is like a scarring tissue, scarring inside your ovaries. Okay. The second stage, actually before we go to second stage, this is ovulation. This is when that happens, when the egg is released and you have the corpus luteum and then corpus albicans toward the end. So you have the primary oocyte and then secondary, and then when the secondary release and you have the egg goes out. Okay, so you have the LH spike, LH surge, causing the blood flow to swell rapidly. This is remember the FSH stimulating the egg, the ovary, whereas LH stimulating the hormone. Okay, and ovulation. The second stage is the luteal stage. Luteal stage, you have the luteal phase, the post-ovulatory phase divided into half, which is luteal phase and the premenstrual phase. Luteal and premenstrual phase. Okay, this is the worst stage for women usually, right at this time. Especially the premenstrual phase. This is when you get the PMS, all the stuff, all those fun stuff. The luteal phase, you have the LH start to come down. You have progesterone and you have estrogen start to peak up. Your estrogen and progesterone start to peak up. Okay. And then you have the premenstrual phase. If you have no pregnancy, the corpus luteum become corpus albicans, then your progesterone and your goes down, and then your menstruation started. Okay, so you have the estrogen peak in the luteal phase, but if there's nothing, no cigar, then you would go down. Okay, everything would go down. The urine cycle talks referring to the wall of the uterus. Urine cycle, you have the proliferative phase, and then you have the secretory phase. You have the menstrual phase, proliferative, and then secretory phase. So proliferative means it's actually start to build up. When you start thinking of building up, you think of mitosis, because you just keep replicating those cells more and more and more. So you just keep double the size, keep making it bigger and bigger. Whereas a secretory phase, you actually start to getting ready, you have more blood going into it, more lining, more fluid, so you get ready to shove that off toward the end. Okay. Proliferative phase, rebuilding that uterine tissue, and secretory phase, getting ready to. You could see in the estrogen, this is ovulation at the week 14. Your estrogen level peaks before and then start to rise again, and your progesterone literally rises high and then comes down. The problem with PMS for most women is that you have low level of estrogen and low level of progesterone, so causing you to actually feeling moody, crampy, all of those lovely stuff. Menstrual phase, you have progesterone fall down, you become atrophy, your blood start to constrict, causing your endometrium to have to shove off those walls. Okay. Couple more and we are almost done. So you have sexual responses. You need to know these. These will be also on your exam. Pretty easy. You have the excitement phase. This is talk about sex completely. Excitement phase and plateau phase. Okay, excitement phase. Just remember, women also have erection as well. Just like men, women do have. You need parasympathetic. We talked about this before, I believe, during endocrine. You don't need to see tiger. If you see tiger, you get erect. There's something wrong with you. Okay, so you don't need to see tiger. You need to be relaxed to cause erection. You have this nitric oxide flow in your blood. You have acetylcholine flow in your blood. So you have dilation of your arteries. So more blood to the tissue. So your clitoris become gorged with blood, and then it actually erect. Okay, so the first phase is unstimulated, nothing happened, you're just sitting reading a book. Where you have excitement phase, things start to more blood going to the labia, to the clitoris. Okay, so vaginal tend to dilate, you have these erection causing clitoris to erect. Plateau, which is meaning this is when you could see in the plateau phase, when the uterus start to actually erect into vertically. If you look at the first one, uterus actually leaning forwards like this. Okay, some women, you have uterus going in the wrong place, which is about 15% or so that kind of lean backward. But for the most part, most people, you lean forward. But during excitement, during erection, your uterus actually stand up. Okay. Plateau, this is when you're getting ready, and then you have orgasm. You could see orgasm. What helps with cervix as well is when men ejaculate right here, the cervix actually pulsating and then picking up some of these semen, some of these sperm onto the cervix tips. It's kind of easier for it to go inside into the uterus. So this is kind of natural spot. So orgasm, resolution phase, again the uterus going back. You could see it leaning back again to the normal position, going forward. Okay. For men, same thing happened. Okay, same thing happened. Men has nothing to do with, people always think penis has the way of its own, the life of its own, but it's not. It actually has to do with your head. Everything is actually inside a man's head. So um, whether that men come before or after, or taking very little time or long time, is all in the head. Because if you think about it, men could actually come without any excitement. Just kind of thinking about things could actually cause them to ejaculate. So men has more to do with the brain. Okay, so with the stages, same stage, the same thing happened. You have the erectile issue going up, because of the nitric oxide, because of the acetylcholine. Same thing, the blood rush into the penis. Penis become gorged with blood. Therefore, you see erection. You have same thing. You have the excitement, plateau, orgasm, and then resolution. Men graph goes like this. It goes up really quickly and then comes down very quickly. Whereas women takes a little time to go up and a little time to come down. Okay. So same stages for men. You have the erection, the excitement phase, the plateau, and then you have orgasm, and wham bam, thank you ma'am, and then you're done with the resolution. No go again for a while. Okay. We talked about these already, so we're not going to spend a little time talking about them. You should review what we talked about before. The resolution stage, you have refractory period, which means you cannot go again. Some are 10 minutes, some actually could be fewer if you train. I've seen some men claim that could be a lot lower, like a couple of minutes or so, or even a few seconds. Some could take a while, take a few hours, few days. As you get older, it might take a few days to recover. Okay, Viagra, not Proaca. Viagra is what it does is actually help stop this GMP, stop the GMP right here. So what it does is actually cause vasodilation, and election. So it's actually help with the blood issue, causing the blood to actually go in to the penis a little bit more. Okay, we talked about some of these already. Acrosome, how the baby, how you get pregnant. We talk about that in the pregnancy video. That you should review. To test whether you actually have this is HCG. Test that whether you get pregnant. We test to see whether you're pregnant. You use HCG, human gonadotropin hormone. Okay, to see whether you're pregnant or not. If you want to see whether you want to become pregnant, when you actually need to get ready for your, this is on your exam, so remember this. You test LH to see whether when you're gonna ovulate, and then you could kind of the best chance for you to actually become ovulate to get pregnant. There's actually a kit that you could buy, Walmart, Target, everywhere has it, to see whether which day you're about to ovulate. And what they do is they test they test your LH level to see whether you're getting ready to ovulate. Okay. We talk about oxytocin, prolactin in your endocrine, so you might want to review those. Okay, so let's now talk about the reproductive disorder. Okay, reproductive disorder. In actuality, there's actually a long list of reproductive disorders. This is a short list that we will go over. Okay, so just kind of basic understanding. Basically, you just need to know the term. There's actually a question or two on the exam that kind of matching question. Just match the description of the disease and the name of the disease. Make sure you just match correctly. Okay, and it's pretty straightforward. I mean, if you know the term and know where things are, then it shouldn't be too bad. For instance, prostate cancer, that's in men, so men should have prostate, and that's when you get older, your prostate actually could develop cancer. Cervical cancer usually has to do with a virus, HPV, human papilloma virus. So if you have certain strand of human papilloma virus, you can get cervical cancer. Ovarian cancer is harder to detect, usually is asymptomatic. That means you don't show any sign, but when you actually have it, when you start having that, it can spread through other part of your body. So it's really crucial for the physician to actually detect that early on. Okay, testicular cancer usually in younger kids, younger boys, in late teens, early 20s, and early 30s. That's when you get testicular cancer. So we're gonna go through these. Just kind of know, like I said, just know the name, know what it is, and some of the symptom. When you have prostatic cancer, these little guys here become cancerous. Okay, usually you get this when you're older. When you're older, you actually have over the age of 65. Most urologists now don't even treat this. They just let it go. You actually will die of other disease. More likely, you will die of other diseases than dying of the cancer. And most of the time, this cancer kind of stay put, doesn't metastasize, meaning that it doesn't go to any part of your body. It actually just stay in your prostate. So for the most part, if you're older, like 60, 70 years old, they may not treat this at all. They just kind of let it go, let it be, you know, because these they just kind of just let it hang for until you probably get heart disease, you get cholesterol problem, you get lungs problems or other things other than prostate cancer. You won't die of that. Cervical cancer for women, this is very important. This is why you do pap smear every 2-3 years now. There's actually several strand of HPV to remember to eat. This is for your future reference. It won't be on your exam, but for HPV, for your future reference, with HPV, you have a lower and a higher strand of HPV. You have a low and a higher strand. Okay. So if you have a lower strand, you actually get cancer. You have these cancer. So like 15, 17, these are lower strand. Whereas higher strand would be like 28, 33, 35. These you will get, it will lead to warts. Okay, you will have warts instead. You have wart growing on your cervicals. So all of the vaccine, we do have vaccine for these. Vaccine actually for the lower strand. It's only covered 2 of them, I believe. And you have to get it every 2 to 3 years. You have to get those vaccine again every 2 or 3 years. It's not going to guarantee for life. If you have, especially if you have kids who actually are sexually active, highly sexually active, we usually recommend getting it because just preventing them to have these cervical cancer. But if you have it once, you get a vaccine once, you have to get it every 2 or 3 years to keep doing the booster. Otherwise, you'll be gone. Okay. So people who don't use any condoms or not protective sex, so things could actually are in a risk group of these folks. Okay. PCOS, this is polycystic ovarian syndrome, PCOS. Like I mentioned before, women actually make cysts for a living. You make cysts for a living. You make cysts every month on a monthly basis because of the corpus luteum. Because of the corpus luteum, you send out the egg and what's left over, and that actually could become cyst. And there are different types of cysts, but majority common people actually have the water cyst, the hydrocele cyst, which mean that you have a liquid bag inside your ovaries. Most of these are really very painful. Some women, usually if you have anything more than 10 centimeters, we usually remove those pretty on a regular basis. OB actually will remove those if you have anything greater than 10. The biggest one is in some rural part of the world. You could actually you just type in YouTube, the biggest ovarian cyst. You're gonna see some is almost the size of a turkey. Yes, you have a size of a turkey of the ovarian cyst stuck in there. Nevertheless, is one of the easiest procedure to actually do. It's very easy to go and remove the ovaries because you only have a few attachment to it. Usually the surgery itself should not take more than 15 minutes, 15-30 minutes, pretty easily. And now sometime if it's small enough, we could do laparoscopically as well. You could just poke 3 or 4 holes and then we'll go in and just remove the ovaries. But the problem with that is if you remove the ovaries, that means no more kids for you. Okay, or if you remove one ovaries, that means you have a lesser chance of having kids because you have one less ovary. Okay. So usually we don't remove it usually, but if it's become really big and painful, then that's when we're gonna remove it. But okay, so and there's a whole bunch of complication with this. You could gain weight from this. You could gain weight from PCOS. You could also develop diabetes from this as well. You could develop hair as well with this. So there's a lot of complication with PCOS. Some women actually become obese, balloons up like crazy. I think there's a show on TLC, My Fabulous 500-pound or something life. The main character in that one also, she had PCOS and then started gaining weight. And then she became 500-pounder. So that's PCOS for you. Next one is endometriosis. Endometriosis, what that means is your endometrium go out and play anywhere else aside from where it's supposed to be. It's supposed to be inside lining of your uterus, but then it comes outside somehow. Okay, come outside somehow. It could be here, could be anywhere outside on the uterus, or be on the ovaries, could be on the outside of the fallopian tube, inside the fallopian tube, on top of the uterus, on the side of the uterus, anywhere. The problem with this is these tissue is reactive to your hormone. So once a month, these tissue will start to develop a wall, will start to develop. Remember, this is the inside lining of your uterus. So these develop a wall and then it will shrivel off just like your period. But if they are outside here, they actually shrivel off inside your peritoneum, your abdominal cavity. Big problem because then you're going to start seeing blood pulls up in your peritoneum. Okay, you're going to have your blood in the abdominal cavity, and then you're going to start seeing pus and you're going to start seeing infection. You're going to start getting into sepsis pretty easily. Okay, so usually when you have these, we need to go and remove these. We have to kind of shave it out, cut it off. Otherwise you're going to have a lot of problems. So pain, usually infertilities. So this is where endometrium is outside where it's supposed to be. You could see this is fallopian tube. You have endometriosis here. The uterus is here. This is so if you let this go, you're gonna have bleeding inside your abdominal cavities. So not good. Next one is PID. On the test is actually, it will abbreviate PID, so remember that. PID, pelvic inflammatory disease. Pelvic inflammatory disease, all it means is actually your pelvic, your uterus is become inflamed. You have inflamed uterus. I don't know why the picture shows inflamed fallopian tube, but it's actually inflamed uterus. Okay, pelvic inflammatory disease. If you, for women, for girls, if you ever had your pap smear, one of the things your OB is supposed to do is to put their finger in and then shake hand with the cervix. They will actually grab your cervix with 2 fingers and then move up and down, kind of do a little handshake there. They actually do that to check your PID, whether you have PID or not. If you grab the cervix and you do a little handshake, if you have inflammation in here, you will scream and cry like crazy. You would jump off the bed, right off the bed. That's what we call a chandelier sign. Chandelier sign is when you have inflammation in your pelvic area, and then causing just moving the cervix will cause that irritation. So you have abdominal pain, you could have fever because it's inflammation causing fever. Okay, and you're gonna have discharge. So, and usually it is associated with STI, any type of infections that going on inside your pelvic area. Okay, like gonorrhea, chlamydia, all the lovely bugs that go in and cause those. Okay. ED, erectile dysfunction, that means it's not going up. ED is ED means these are precursor. Okay, just think of these a precursor to your heart problem, your congestive. Actually, it's cardiovascular. Vascular disease. Okay, cardiovascular disease. So this is just a precursor to your CVD, your cardiovascular disease. So if you have hypertension, if you have high blood pressure, if you have anything that has to do with coronary stuff like clogging of your arteries, all of those stuff, you're gonna see ED first. This is a precursor to that. Okay, you patient oftentimes will have these. Okay, so like older men, obesity, diabetes as well, and heart problem. Okay, so they just because of their blood vessel is clogged, so the blood cannot really go into the penis and then cause the penis to erect. So Viagra, oftentimes we use Viagra to dilate the blood vessels, so there's more blood flow that it could go into the tissue. Okay. Uh, and you definitely need to know some of these, and what do they cause, what kind of bug do they cause. Hepatitis is the virus. This is the virus. Okay. This is cause inflammation of your liver. That's A, B, C, D, and E. So there are 5 of them. Anything that starts with a vowel come from the bowel. Okay. So anything that starts with a vowel come from the bowel, which means it's oral fecal. That means you didn't wash your hand, you rub your butt, you wipe your butt, and then you go on and cook. No one in the world will rub their butt and then start licking their fingers. That's just weird. But yes, these when that's why they in a restaurant we recommend that you wash your hands, even the servers and also the cook wash their hand. If you go to Mexico sometime, a lot of time actually we have these people get a souvenir back from Mexico because those cook down there didn't wash their hand. But I'm sure with the pandemic that we have, everyone's going to become OCD and everyone just going to wash their hand all the time, so we'll see less cases of these, I'm sure. Okay, so it's a virus that causes your inflammation in your liver, cause your liver to become cirrhosis. Okay, next one is HIV and AIDS. This is a virus as well, another virus that cause HIV and AIDS. So virus is HIV. This is attacking your immune system. So your immune system, this is your T cell. It attacks your T cells, your CD4 and your T cell. Okay, this kill your T cell. You remember from your immunology chapter, what does T cells do? T cells does a lot of things. These guys activate B cell. These guys go fight up front. These guys also go and be a support group for a lot of folks. So if you don't have this guide, a lot of your immune system could become weakened, and then things could actually get into your body. Okay, these two, chlamydia, gonorrhea is STI, is sexual transmitted disease. Chlamydia is very common. You have this very common infection women tend to get, but then can spread around too as well as men. Most of the time it's asymptomatic, but they do have a certain smell to it with chlamydia. A certain smell to it. For gonorrhea usually women is asymptomatic. Okay, so gonorrhea is also a bacteria. This is a bacteria. Women usually asymptomatic, which means no symptom. Women has no symptoms whatsoever. Men, you will actually have a painful white discharge. Painful white discharge. You feel like it's gonna burn so bad. It actually have these white milky discharge come out. Herpes is a virus. Herpes is a virus. There's 1 and 2. 1 is oral, 2 is genitalia. Majority of people have 1, 95%. Only 10%, 5 to 10% have 2. Okay, which is genitalia. Okay, you have these clear vesicles, clear fluid vesicles on your lips, on your genitalia. But it could go on anywhere in your body. It could on your arm, your hand, your body, anywhere. So HPV we talk about. This is the virus that cause warts and cause cervical cancer. Syphilis is a bacteria. These guys are bacteria. Very easy to treat, as well as gonorrhea. Same treatment. But usually, Tom, you have these vesicle. You have these ulcer. You actually have ulcer, but it's not painful and it's not itchy. So non-painful, and non it's not, it could be a little itchy, just a little bit of kind of almost like a rash, just a little bit of itch, but not too much. So a lot of times it actually come in 3 stages. This one, stage 1, 2, and 2 and 3. Stage 1 come in for about 3 or 4 days, 5 or 6 days actually, and then it goes away. Stage 2, after stage 1 it lay dormant for about 3 or 4 months. Lay dormant for 3 or 4 months, and then it come back in stage 2. And stage 2 is going to be all over your body, your face, your toe, head to toe is covered with it. Your body, your chest, your arm, your legs is covered everywhere. If you don't treat in the first 2 stages, if you don't treat in stage 1, you don't treat in stage 2, some people kind of ignore them because it's not painful. It just come and go. It actually takes a few days and goes away after 5 or 6 days, after a week. So people don't go in to see the doctor and don't get that treated. If you don't get that treated, it will lay dormant in your body for 30, 40 years. And when it comes back, go into your heart, go into your brain, and you're gonna die from it. Once it go to stage 3, there's nothing we can do. And there's no treatment for stage 3. Okay, so stage 1 and 2 we could treat easily. We could actually give you antibacteria. It's gonna go away. This one, once it get into your heart, get into your brain, you cannot treat them. Okay, and that's it for this slide. I hope you have fun. It's been a thank you for watching. If you like this, please click subscribe, hit the like button. Thank you for watching, and I'll see you next time. Bye.